This presentation is for vets and vet-led teams carrying out the Animal Health and Welfare Pathway Annual Health and Welfare Review for sheep. Content contains specific guidance on health and welfare aspects of the review and is intended to provide a useful overview of requirements for vets working solely with sheep and details on resources useful for vets who do not work exclusively with one species. Some slides may be useful to share with the wider practice team, where they are supporting you in delivering reviews on farm. The Annual Health and Welfare Review gives vets the freedom to decide with farmers where to focus. As such, vets are incredibly important to the success of this programme. The content of this presentation covers where to find official and practical guidance, details of the review and report requirements, suggestions for sheep-specific health and welfare areas you may wish to consider in your review discussions, your recommendations and report requirements, farmer funding opportunities, tips to prevent issues, and where you can get further support. Links to useful resources which are provided within this video can be accessed in the YouTube description box below the video. You will need to exit full screen view to see these. These links are also provided on the AHDB web pages. We recommend watching this video in full before dipping into any additional resources you may require. The video is broken down into chapters with a unique reference number for each resource. For example, here 1.1 relates to Chapter 1, Link 1 in the Resources list. Resource links will open in a new window. Official guidance on the Annual Health and Welfare Review can be found on the government web pages. These pages provide information for farmers on the eligibility criteria, plus a 7-minute video demonstration on how to apply and how to claim payment. This video may be useful for the practice team to watch if they receive calls from farmers with queries about the review process. For vets, the web pages provide guidance on how to carry out the Annual Health and Welfare Review, plus specific requirements for disease testing. It is essential that the official guidance is followed to ensure that farmers are able to claim the payment. If you or your clients have any queries on the Annual Health and Welfare Review or the wider Animal Health and Welfare Pathway Programme, you can contact the Rural Payments Agency. Contact details are on this slide. There are 5 separate 20-minute videos in this series designed to cover a mix of official and practical guidance on different aspects of the Annual Health and Welfare Review. This industry guidance should be used in conjunction with the official guidance and is not intended to replace it. Each of the 5 videos is divided into chapters to enable you to dip into relevant sections. The first 3 presentations cover species-specific guidance on health and welfare aspects for pigs, sheep and cattle, both dairy and beef. The final 2 videos cover biosecurity and details of the disease testing required for the review, with content split by species for user ease. Farm Vet Champions, provided through RCVS Knowledge, contains over 20 hours of continued professional development, or CPD, to support and empower vets to tackle antimicrobial resistance with online tools. There are 3 mandatory elements to the Annual Health and Welfare Review: a vet visit to the farm, disease testing, for sheep this is the worming treatment check, and 2 reports: a written report for the farmer providing recommendations and actions, and a summary report which the farmer will use for audit purposes as evidence the review took place. Details of these are given later. These compulsory elements enable the farmer to claim the review payment. Specific requirements for the worming treatment check are detailed in the disease testing video within this series. All aspects of the review are designed to be for the farmer and flock benefit, not for inspection or compliance. The review is intended to provide additional vet-led input beyond the current level on each individual farm. Content of the review is otherwise flexible to allow the review to concentrate on individual farm needs. The review can be carried out at any time to suit you and your client, and the best time might coincide with a client's priority need, for example when seeking vet advice on lamb survival. The worming treatment check will still need to be carried out at the appropriate time, usually midsummer to early autumn. You may wish to consider the following when planning diary dates: the convenience of having feces samples collected by the farmer or another member of the team. You should ensure the farmer knows how to take a good sample. the seasonality of disease, and whether disease testing may be more appropriate earlier or later in the year. For sheep, it is best to carry out the worming treatment check between midsummer to early autumn, when you would usually expect to carry out a worming treatment. You will need to discuss test results with the farmer and make appropriate recommendations, so you may need to separate your review meeting from the results discussion once the worming treatment testing has been completed at the appropriate time. An important point to note is that the farmer must submit the claim within 6 months of application. The farmer can apply for subsequent reviews of the same species every 10 months. At the end of the review, you must agree actions and recommendations with the farmer and produce 2 reports. These can be in electronic or paper formats. The written report described on the left of this slide is for the farmer and flock benefit. It is not shared with DEFRA and will not be used for any regulatory or inspection purpose. The report can be a standalone document or included as part of another document. Wherever it is recorded, it must be clearly identifiable as annual health and welfare review information. This report should include the worming treatment check test results, your advice and recommendations, and agreed achievable actions. It should be reviewed each year to encourage progress. The summary report provides evidence that the review took place. The farmer will need to provide this to the Rural Payment Agency for auditing purposes. The summary report must include the agreement number from the Rural Payment Agency application, the farm business name and single business identifier or SBI, the date of the last visit for the review, the type of livestock, confirmation that 21 or more sheep were present at the review, confirmation the worming treatment check test was carried out, the laboratory test unique reference number or URN, your name and RCVS number, confirmation that the farmer has been given a written report, and your signature dated. Vets working solely with sheep will need no guidance on suggested focus areas for health and welfare in sheep, but for vets who do not work exclusively with one species, the following industry priorities and resources may be of interest and support you in your on-farm review discussions. The following priorities for sheep have been identified through government and sheep industry partnership working. You may wish to consider looking at these optional areas within the farm review. Tailored health screening, looking at internal and external parasites, mastitis, abortion, and the 5 iceberg diseases. These include Maida visna, caseous lymphadenitis, border disease, Johne's disease, and ovine pulmonary adenocarcinoma. Tackling lameness using the 5-point plan. Increased use sustainability through optimised nutrition and body condition scoring. Review of castration and tail docking with improved pain management, and improved lamb survival through colostrum management. Further suggestions for areas you may wish to consider with quick links to useful resources are provided on this slide. These include those for neonatal survival and colostrum management, flock vaccination status, key performance indicators, mortality reasons and percentages, getting the most out of EID, seasonal antibiotic usage, and maintaining healthy feet. Guidance for vets on internal and external parasite control can be found through the following organisations: SCOPS, AHDB, Morden, Combar and NARDIS. Quick links are provided on this slide. To maintain domestic and export markets, it is becoming increasingly important to evidence responsible antibiotic use. The first step is to know what we use nationally. Medicine Hub is an online tool to help dairy, beef and sheep producers monitor and compare medicine use and tackle the threat of antimicrobial resistance. The tool, once populated, will help demonstrate national responsible antibiotic use. This is a consumer concern and is therefore of a reputational benefit to the sector. A key long-term objective is to get all sheep producers registered with Medicine Hub and upload data on antibiotic use over time. Instructional guides and video demonstrations are available on the Medicine Hub web pages to guide you. Farm Vet Champions, provided through RCVS Knowledge, contains over 20 hours of CPD to support and empower vets to tackle antimicrobial resistance with online tools. The review also presents an opportunity to review other areas of medicine use on farm. Farms under an insurance scheme should already have vaccine plans, medicine use advice and storage records on their health plans. For others, some advice or training in these areas may be useful. In addition, the review could provide an opportunity to promote culture and sensitivity testing or look at areas where there is relatively higher antibiotic use. Whilst biosecurity is covered in a separate video presentation, it is of such importance that it is briefly mentioned again here. It may be useful to explore areas of potential risk to support a plan, protect and prevent approach within each flock. Newly purchased, returning or neighbouring sheep present the biggest risk for introduction of new diseases and disease strains, and key areas are highlighted on this slide. These include purchasing, quarantine, testing policy, a review of boundary biosecurity, use of common or shared grazing, feral sheep, and farm manure management risks. Species-specific codes of recommendations for the welfare of livestock provide a practical interpretation of relevant legislation. The legislation requires that any person attending an animal must be acquainted with the relevant code of practice, have access to the code whilst attending the animal, and have received instruction and guidance on the code. It is therefore a good idea to ensure the farm has the code of recommendations for welfare of sheep handy, as it provides a useful source of advice. As part of the review, you must set agreed achievable actions with the farmer, tailored to the individual farm with clear targets. These must be reviewed at the next annual review, if not before. Your advice, recommendations and agreed actions must be included in the written report you provide for the farmer. Based on individual farm needs, you may wish to set some easy wins and stretch targets. As per previous slides, a relevant grant opportunity may assist. When you agree actions with the farmer at the review, encourage them to consider if grants offered by the government could help them in carrying out these actions to achieve health and welfare improvements. Grants provide up to 40% of the costs, are accessible to farmers that are not in receipt of the Basic Payment Scheme funds, and to farmers with or without an annual health and welfare review. However, applications for grant funding that demonstrate genuine need for specific pieces of kit following advice from the vet and are linked to an annual health and welfare review are viewed advantageously. Two types of grant are offered through the pathway: farming equipment and technology grants and infrastructure grants. Both are part of the Farming Investment Fund, and details can be found on the Farming Investment Fund gov.uk web pages. The Farming Equipment and Technology grants provide match funding for equipment and technology items which improve the health and welfare of sheep, pigs, dairy and beef cattle, laying hens and broilers. Infrastructure grants fund transformational projects that enable farmers to achieve higher levels of animal health and welfare. The initial offer co-funds new and upgraded calf housing to improve social contact and the ambient environment. In time, the offer will be extended to include grants for adult cattle, pig and poultry housing. Farmers need vet advice to apply for this grant. The Annual Health and Welfare Review provides this. For the latest updates on both grants, follow the DEFRA Farming blog. Further government funding to prevent and reduce endemic diseases and conditions will be available in 2024 through disease eradication and control programmes offered through the pathway. We have included some tips to help prevent potential issues on farm with the lab and in your discussions. On farm, potential issues include selection of the wrong animals, the wrong number of animals, insufficient, poor or incorrect sampling, incorrect intervals between treatment and collection of samples, and incorrect dosing. It is a good idea to monitor the fecal egg count of the group leading up to the worming treatment check test to make sure it's high enough to warrant treatment. Please refer to the separate disease testing video in this series. At the lab, potential issues include postage delays due to strikes and missing or incomplete sample submission forms. Please use the bespoke laboratory submission kit and form and complete all sections in as much detail as possible. Finally, when planning review discussions, do you have all the necessary information and knowledge? Do you have a plan for next steps, and are there any unexpected test results? The laboratories will be able to provide guidance if you have any questions. A number of organisations are supporting the rollout of steps within the animal health and welfare pathway and are providing material to support both farmers and vets. The organisations on this slide are useful sources of advice and technical guidance. For support with effective communication, it is worth knowing that Farm Vet Champions provides vets with 3 hours worth of CPD divided into handy bite-sized sections. A reminder that if you or your clients have any queries on the review or the wider animal health and welfare pathway process, you can contact the Rural Payments Agency. A quick continued professional development reminder to add 20 minutes to your CPD record after viewing this presentation. Add additional time if you viewed other presentations in this series or clicked into further resources. The RCVS 1 CPD link has been included on this slide for quick access. Thank you for watching this video. If you have a spare 20 minutes now, you could follow the resource links on this slide to view another video in this series, or dip into resources on the RCVS Knowledge Farm Vet Champions website.